why are the pills so readily available when the necessary procedures and or screenings like an MRI? I remember, and I'll just say this, I remember being in the emergency room with this because I thought that my back had exploded. I'm in the emergency room in the middle of the night, and they were like, we can't give you an MRI, but we can try to get you in a CAT scan. And then, of course, he offered me a morphine shot that he was going to administer, which I said no to because I have tough veins. I was like, no. And sent me home with the Oxycodone?
Oxycontin.
Not cotton. Codone. Codone?
Okay.
Oxycodone. Sent me home with a ton of those and some muscle relaxers. And I still had no idea what was wrong with me. So why was I not allowed to have an MRI, but I was given a ton of opioids?
Yeah. No, that's a great question. And that is the crux of the issue. So I have to break it down for folks. Insurance has no ability to monetize MRIs unless they own the MRI center. And right now, that is not something they've captured. Insurance companies have captured the pharmacies, the pharmacy benefit managers, the middlemen that Trump alluded to the other day.
The horrible middleman that makes more money, frankly, than the drug companies, and they don't do anything except they're a middleman. We're going to knock out the middleman.
And I talked about this on Rogan years ago. The pharmacy benefit managers were an institution established to negotiate on behalf of the American people to drive down the cost of prescription medications, to make prescription medications affordable for all of us, and to be a patient care advocate and be a voice for us in a room where we didn't have one. And the insurance companies in the 80s, when we rolled out HMOs, captured those companies. So the 5 biggest pharmacy benefit managers are owned by the 5 big insurance companies. And I explain it. Think of like Scooby-Doo when you're saying, who was the ghost? They pull back the mask and it's Mr. Rogers the whole time. That's what it is in this in our healthcare space. And why that is so crucial to understand is in the 80s, they went from negotiating on behalf of us to negotiating against us. They went to the big pharmaceutical conglomerates and they said, hey, you're only charging us $100 for insulin. Charge us $200 for insulin and then give us a rebate of $100. So United Healthcare shows you, Jillian, that they paid $200 for your medicine that month. They show it like at my company as an employer, right? I employ, like I said, over 300 people. They go, Brigham, Jillian was costing us $200 a month on this medicine. They never paid the $200.
They paid
because they got a $100 rebate. Yes. And that $100 rebate goes to the middleman, the pharmacy benefit manager, where they hold that profit. Then they make it look like to your employer and you that they paid this exorbitant amount for that medication, but they never did. They charge you a bigger copay, a bigger deductible, and at the end of the year, they readjust the rates and the premiums for your employer. So at the end of the day, it's the employers and the taxpayers paying for this marked up drug cost. And that is why the cost of insulin, absolutely. And that is why insulin has gone from $100 a month to I think like $500 something a month. And there was a Senate House Special Investigative Committee, the Finance Committee, that dug into this, and they found that roughly 30 to 40% of the profitability was being held by the pharmacy benefit manager. And that is why we were paying inflated drug costs.
Okay, now.
And it gets more sickening, Jillian.
Okay, yeah.
Because
I know what you're going to say. I was going to ask you this. I already know what you're going to say. Go, because this is the question I was going to ask.
I was going to say, if we look at what they do with the federal government said, hey, we're not really good at managing drugs, so we're going to punt this off to the big insurance companies. So the same 5 big insurance companies manage Medicare and Medicaid. Okay, and their PBMs show the federal government that artificially inflated price. And they go, hey, look, federal government, Jillian and the rest of America is paying $200 a month for this drug. Since you're the federal government, we'll sell it to you for $190. But they set the fake price.
Because they're paying $100.
So all of it is a lie. It's a lie agreed upon. And then the federal government, in all their infinite wisdom, gave a safe harbor carve out to the PBMs in the 80s that said, we don't have visibility into your pricing and your pricing negotiations.
Okay,
and so
go.
Yeah. And so where I'm going with this is you and I have talked in depth in our previous podcast about the corporate capture of the FDA, the collusion, the cross-pollination, people leaving the public industry to go work for the private industry.
Yes.
You know, the head of the FDA went to go work for Sackler after approving opioids and Oxycontin into the marketplace and wreaking havoc on hundreds of millions of Americans. The same exact Ponzi scheme is happening in the insurance framework. The head of AMA, the woman who helped push through Obamacare,
AMA,
left.
American Medical Association?
Well,
No.
This is Medicare and Medicaid's oversight. Like,
got it.
The government entity that holds
regulates
Medicare
and Medicaid.
I think I meant to say ACA.
Got it. Sorry. Okay,
yeah,
go.
so that entity, she helped push through Obamacare. ACA is essentially Obamacare. She helped push that through. 12 months later, went to go work for the big insurance companies. Literally got a huge payday, left working for the federal government, went to go work for those big insurance companies. She set up all the Medicare, all the Medicaid programs. We outsourced all that to these pharmacy benefit managers and insurance companies, and they're raking us over the coals because it's us, the taxpayers, paying for all of this. We're paying the overinflated prescription drug costs. And an example of how I can highlight this, the state of Ohio did a forensic audit because they said something's not right here. When we're looking at our prescription drug cost as a state, what we're figuring out is our Medicaid cost is higher than the average wholesale price. So at the state level, they don't have the negotiating and bartering power of the big bad federal government. So the insurance companies are screwing them even worse than they're screwing the federal government and the private payers like us. So what they found in 1 year alone, $240 million in what they call, I would call it price gouging, but they call it price discrepancy or whatever, spread pricing. The insurance companies try to say, oh, it's spread pricing. No, it's you fucking us. Like, let's be clear here. You are absolutely price gouging the states, the federal government, and people. And that, Jillian, is why people are furious at these insurance companies. They're denying our ability to get access to treatments. They're ramrodding treatments that line their pocketbooks. It's the same narrative that we faced since the 80s. It's not about patient outcomes. It's about profitability. It's about quarterly earnings. And while we are dying at a breakneck speed, deaths of despair at an all-time high, we're ranked 60th in the world in healthcare. I mean, which is pathetic. That's a travesty. The average American man dies 10 years younger than the average Japanese man. Like, we could go through all of these statistics.
We both know them.
But at the same time, United Healthcare's profits have gone through the roof and their stock price has doubled. In 5 years, their stock price has doubled. While we are dying in the streets and dying of chronic disease, they are profiteering and monetizing sickness. And that is why people are disgusted with these CEOs. They are an implicit actor in this evolution and destruction of America. And they can pretend like they're a passenger. They're not a passenger, Jillian. They are double the fucking size of the pharmaceutical companies. They did $2.5 trillion. They're juggernauts. They are not small. They're double the size of $1.5 trillion. They're double the size, and they're projecting they'll be $1.9 trillion by 2029 in revenue a year. United, $370 billion last year in revenue. Sorry, $370 billion in revenue, just United Healthcare. And guess how much of that came from marking up our prescription drugs? Almost half. Almost half of their profits are coming from fucking us at the pharmacy benefit manager. Sorry for the curse words, but that's how.
Thank you so much for watching. If you enjoyed the podcast, please like, comment, subscribe, and share. And make sure to let me know what guests you want to see on in the future.